Often people get very confused between the idea of insomnia and the idea of sleep deprivation. They sincerely believe that if they are suffering from insomnia, in other words, an inability to sleep, that in fact this is almost the same as being deprived of sleep. In the same way that people would be, for example, if they were undergoing torture. So they have this idea in their minds that something terrible is going to happen if they don't sleep. So the first thing really is to allay that fear. The second thing to think about is this insomnia something which developed over time, or is it something which has only occurred recently? Now sometimes we may want to treat this problem from a behavioral point of view. That means dealing with the problem itself as opposed to dealing with what may have been the cause of the problem initially. We treat the insomnia as something that is a problem because it has almost become a habit. In other words, people go to bed not to sleep. We need to change that habit. Any habit, any patterns of behavior, hypnosis can help you to change. If, however, there are patterns of sleep which would indicate to us that maybe the person is suffering from anxiety, for example, difficulty going to sleep, and then interrupted sleep once sleep is obtained, and they may also have an inability to go back to sleep, then we may well begin to actually treat the cause of the anxiety, which is the cause of the sleep problem, rather than the behavior. It takes a very short time for us to work out which is the best approach to use. And usually, both approaches are very effective.